Be sure to have all of the following items before you begin: 1 multiple dose vial of progesterone in oil for injection, 10 milliliters, 10 cc's. 1 syringe. 1 long needle for administration. Alcohol swabs. Sterile gauze. Safety container. Check that the progesterone in oil for injection is clear and colorless. Do not use if the solution is cloudy, discolored, or contains particles. Wash your hands with soap and water and make sure you're working on a clean, flat surface. Using your thumb, pull the protective plastic cap off of the vial. Wipe the top of the vial with an alcohol swab for each injection of progesterone. Remove the wrapping from the syringe. Carefully pull or twist off the needle cap. Draw air into the syringe by pulling back the plunger as far as needed to withdraw the milliliter cc dose of progesterone in oil that you've been instructed to take. Place the vial on a hard, flat surface. Carefully insert the needle through the marked center circle of the rubber stopper. Gently press on the syringe plunger. This will allow the air to enter the vial, which makes withdrawing the solution easier. Without removing the needle, invert the vial and slowly pull back the needle as far as needed to withdraw the milliliter cc dose of progesterone in oil that you've been instructed to take. Make sure the tip of the needle remains in the liquid by slowly backing the needle out of the vial as you withdraw the solution. You will only be using a portion of the medication for each injection, not the entire vial. Remove the needle and syringe from the vial. To remove any air bubbles in the syringe, point the needle upward and gently tap on the syringe. When all bubbles have risen to the top, slightly press the plunger until a small drop of solution appears at the tip of the needle. Recap the needle. For intramuscular injection, choose an injection site as directed by your healthcare provider. The upper-outer quadrant of the buttocks will be demonstrated. Alternate sides each day. Clean the injection site with an alcohol wipe and let air dry. Uncap the injection syringe. Hold the syringe the way you would hold a pencil. Use the thumb and index finger of your other hand to gently spread the skin at the injection site. Insert the entire length of the needle in a quick dart-like motion at a 90-degree angle, straight in. Hold the barrel of the syringe with your non-dominant hand and very gently pull back on the plunger just a bit to check for blood. Do not pull forcefully back on the plunger. If there is no blood, push the plunger in a slow, steady motion until all the medication is injected. If there is blood in the syringe, remove the needle, change the needle, and start the injection again at a different injection site. This does not happen very often and is not a reason for concern. Once the injection is completed, gently withdraw the needle and apply pressure to the injection site with a sterile gauze pad. Discard the used syringe and needle in your safety container.